How do I treat a weeping wound? The most effective method of treating a weeping wound may vary depending on the discharge that is oozing from the wound. If the discharge is thick and yellow, this typically indicates an infection that needs to be treated by a medical professional. Blood that seeps from a wound may be stopped by applying pressure to the area. Dirt and debris should be gently cleaned from the area with warm soapy water. Do not scrub a weeping wound. Depending upon the severity of the wound, constant pressure should be applied for at least 20 minutes or until bleeding has stopped. Always use a clean cloth or gauze and avoid using tissue, as this may cause further damage to the skin. If the wound is due to a burn blister, do not attempt to break the blister. If you notice fluid seeping from the blister, keep the area clean by gently patting it dry, then cover it with a loose, sterile bandage. Change the bandage on daily or more often if it becomes wet from fluid seeping through. Forming a blister from a wound is your body's way of protecting you from foreign matter and infection. Although a blister can be annoying, it serves an important function and must not be forcefully broken or popped. If, however, the blister is larger than 4 inches, 10.2 centimeters, you should consult with a physician. Be aware of signs that indicate a burn may have become infected. If you experience redness, pus, or severe pain, see your doctor promptly for treatment. Doctors often treat an infected wound by performing a procedure known as incision and drain. After performing the procedure, your doctor may advise you to soak the wound up to 3 times daily in warm water. He may also prescribe a course of oral antibiotics to be taken for about 10 days. You should not attempt to treat an infected wound without advice from a medical professional. Quite often, a minor scrape or cut will cause slight weeping. A weeping wound that causes a small trickle of blood to ooze is generally nothing serious. After the area is thoroughly cleaned, apply some antibiotic ointment and a bandage. The bandage will prevent dirt and germs from entering the bloodstream through open skin. A bandage will also help the wound heal by allowing the broken skin to eventually close. If your weeping wound is 3 inches, 7.6 centimeters or larger and you are unable to stop the bleeding or oozing of blood, you should seek medical treatment. If your physician's office is closed, go straight to the hospital emergency room. A deep wound might require sutures. Your physician